Hi, and welcome to the Aging Answers podcast. My name is Rob Faubion. I am the Chief Community Engagement Officer for Age of Central Texas. We are a regional nonprofit organization that serves older adults and family caregivers. And we are so excited that you're joining us today as we relaunch our Aging Answers podcast. This podcast is sponsored by HEB, because no one cares more about older adults and family caregivers in Central Texas than your friendly HEB. Joining us today is Lauren Duerksen. She is the program director for the Age of Central Texas Thrive Social and Wellness Centers. And today we're going to talk about adult day health. Lauren, we know that this is a topic that is getting a lot of attention now, but most people are really confused about what exactly is adult day health. So help us understand.
Absolutely. So adult day health centers are non-residential activity and health service centers. So this is daytime care and social wellness support for older adults with physical and cognitive needs. So what that looks like is you bring an older adult to a adult day center. They come in, they have breakfast, they do lots of activities throughout the day, things like games, brain boosters, exercise, art, music, a really rich variety of events that are going on throughout the day. They have lunch, a snack, and then they go home at the end of the day. All while they're here with their peers, they're here with a nurse who can give meds while they're here during the day, and they're in a safe place, socializing with people their own age, being stimulated and having a good time, getting fed, and hopefully going home tired at the end of the day.
That sounds wonderful. So, for example, if my mom is living with me and she has a cognitive issue such as, let's say, Alzheimer's, and I need to go to work, but I can't leave mom at home by herself, she could go to an adult day health center to spend the day.
Yeah.
And it sounds like that would be a great opportunity for her because it would provide socialization, an opportunity to have engagement, to actually have purpose in her day.
Absolutely. We have people who come here to socialize, have a safe place during the day to be, which gives the care partner a break, but also for our older adults who are participating in the program, they have a sense of purpose, they have a community, they have friends. And we also don't need to worry if they're getting fed during the day. Maybe if you leave your mom at home, you may leave a sandwich for lunch, but we're not sure if mom eats that at lunchtime. So this way you do have a community of people who are looking out for your mom and who can communicate with you on what is going on through the day. Maybe she's not that hungry at lunch. Maybe she only ate a roll for lunch, things like that. So we can kind of give you more insight on what's going on throughout the day. We also have a lot of reasons that people may need adult day health services. Maybe you just need a break and you need to make time for yourself. That's great too. We have a lot of people who are still working from home because of COVID, and it's really hard to get things done at home when you have mom needing lunch, dogs barking at the Amazon guy again, kids homeschooling, hopefully not, but anymore. But everybody needs a break to be able to focus on their work or just get a break themselves. And we've really noticed that, especially coming out of COVID, both parties, the participant in the adult day center and the care partner, need a break from each other. How much time have we spent at home? We're sick of each other a little bit. It's okay to admit it. And we've run out of things to talk about. This gives you a really great opportunity to have more things to talk about your friends at the center, things like that.
You know, that's so true. We think about adult day health as being primarily for the care recipient because it does provide that socialization. You're providing activities, you're taking care of your big three: socialization, mental stimulation, and physical activity. But this is also a great opportunity for the care partner, for that caregiver, because Caregivers have to take care of themselves. They have to find the time for themselves. And when you're caring for another person, you tend to put all of your focus into that and not into yourself. And you tend to burn out very quickly. And using adult day health is an opportunity to have that respite for yourself as a caregiver, because you know that your loved one is somewhere that is safe and secure, so you don't have to worry about them. You can go do your job. You can go to the grocery store, get your hair cut, whatever it is that you need. So that's very true. That's most people don't think about adult day health as being for both the care recipient and for the caregiver.
Absolutely.
So when someone is looking into adult day health, what are some of the questions that they need to ask when they are exploring a center? When they go to visit, what are some of the questions they need to ask of the community?
That's a great question, especially if you're shopping around, if you have different options. Find out what the cost is, find out what that includes. Are there financial supports if you can't afford a private pay rate? And what do those look like? We also really encourage, to find out if the daycare is licensed. What does that mean? That means that staff are CPR trained. They have continuing education. What does that look like for the staff specifically when they need to do their continuing education? You want to see what the schedule is too. What are the activities? Do I need to go every single day for the full time that the center is open, or is there some flexibility? Find out those questions, make sure it'll work with your schedule and with the participant who would be joining the center. You want to see if there is somebody to support any medical needs. Find out and also if there is an emergency plan, and what is that emergency plan? That is a really big question that we all want to know when we're searching for somewhere where you're going to put your loved one. And how another big thing, especially at Age, we really pride ourselves on partnering with caregivers to take care of the participant. So we really see this as a partnership. You want to ask, what is the communication like with you?
Mhm.
Am I going to hear every single day? Am I going to, if there's a problem, how will I hear in the first couple weeks that my person's attending, things like that. And here at Age, we really, really pride ourselves on partnering with care partners. We take that word very seriously, that term care partner, and we want you to feel supported and not alone in this journey of caregiving.
You mentioned licensed, and here at Age of Central Texas, our adult day centers, our Thrive Social and Wellness Centers, are licensed facilities. We have one in Central Tech, Austin, in the Hyde Park area. We have another in the Round Rock area, and we are getting ready to break ground, very excited, on building a brand new center in South Austin. And all of them are or will be, including the new one, will be licensed. What does that exactly mean? So we're licensed with the state of Texas. And what does licensing entail?
Licensing, it's a lot of work. So we do accept, here at Age, we are licensed. We accept Medicaid. So people who have Medicaid can come here at no cost to them. Medicaid covers that, which is huge for us. That really promotes economic diversity. This is a great way to make care accessible for people. And that's what we are all about here at Age. We want to make services accessible to anybody. We also are required to have a 1-to-8 ratio. So that's one staff member for every 8 participants or older adults who are participating in the program. At Age, we do strive for a 1-to-6 ratio. So that could be another question you ask too as you're shopping for daycares. See what the ratio is for the staff, and what the staff's doing throughout the day as well. So that's another big thing. We also get audited by the state. They want to make sure that we have a safe, healthy place for people. And they really are very stringent on their audits. They want to make sure we're charging them correctly, we're treating everybody right, and that it's a nice place to be. And that can also be a fun thing on my side of management, is when somebody comes in, an inspector, and it's just like, this is such a nice place. So it's always it can be stressful but fun.
And that just means that for caregivers, they know that somebody is looking over our shoulders
Absolutely.
at the care that we are providing. So that adds another layer of confidence for them, that they know that if, as a licensed facility, that a licensed facility is going to be inspected, that they are following certain regulations that are required. And so that adds that layer of confidence for them. You mentioned Medicare as a pay option. Also, with Age of Central Texas, we're licensed with the Veterans Administration as well.
Yes, and we are also audited by the VA to make same regulations, make sure we're following regulations, as well as getting referrals from both of those entities, from Medicaid and the VA. So if you have an older adult who either has VA or Medicaid benefits, chat with a social worker and see if they would be authorized to get adult day health services. That is the biggest way that we get referrals from the VA, is social workers knowing that we exist and being able to refer them to us. So we have quite a few members who are both Medicaid, VA, and here at Age of Central Texas, if you don't have those benefits, we offer a sliding scale application, because again, we don't want anything to be a barrier to services. So please, if you're looking into something at Age specifically, make sure to reach out and see what your options are.
Right, because we know that healthcare is very expensive, especially when we're talking about memory care options. Speaking of that, long-term care, most people don't realize that their long-term care insurance will also pay for adult day health, that it qualifies as a long-term care.
Exactly. And another thing I forgot to mention, Rob, is you want to check to see if transportation is included. I know that's a huge barrier as we're talking about barriers in aging, especially in Austin. It can be really difficult to find transportation options. At Age, we do offer transportation based on location and availability on our buses, but we pick people up from their homes, bring them to the center where they enjoy the day, and then take them home at the end of the day. So that's another thing to look into as you're looking at day centers.
And that's a real big bonus, especially here in Central Texas. We were talking about cost, and that was one thing you need to ask, and ask what is included, because some places don't offer everything as a package, that you pay extra for this and extra for that. And with Age of Central Texas, ours is all inclusive. Everything is included: the meals, the activities, transportation, nursing oversight, everything is all one package. But it is important to ask that question. Just don't assume that everything is going to be included, because some places, we have found in our research around the nation, not everybody has the same thing. It's not an apples to apples, oranges to oranges comparison.
Exactly. I think another big benefit here at Age is that we have so many programs that really help support care partners and older adults. We have our care partners here have access to our health and equipment lending program, where you can get durable medical equipment on loan for free. We have an amazing resource and information center where you can get, so you kind of, beyond the actual Thrive Center, you get so many more services when you're part of Age. And once you're in the door, you'll be able to find anything that you need here. So I think that's a big benefit, and also kind of see what's included in the organization you might be looking at, or where can they lead you to if they don't have the services that you need.
That is so important here at Age of Central Texas. Of course, we've been serving the community for more than 3 decades, serving older adults and family caregivers. And so we have a wealth of programming that can help support both the older adult and the caregiver. And so being a part of the Thrive Center, is not in, you don't have to be a part of the Thrive Center to access the other programs, but it does open that door for you for everything that we have available that you might not realize that we have that could assist you, such as support groups. You mentioned the resource center. That is such an important opportunity because we know that our caregiving journey changes as we go along. And so having those experts that can help you and guide you as things are changing, and behaviors with your loved one are changing, and you're like, why are they doing this and what's going on here, and having an expert to explain is because of this. And then you go, oh, okay, now I know how to deal with it. And also having the staff at the center that can tell you, hey, we noticed mom is starting to do this, and we think it's because of this, and here's how you can deal with it when you get home, is always a big help. And we always say that caregiving is never something you should do by yourself, because none of us have the knowledge base to do it by ourselves. I'm a caregiver myself, and I am constantly looking to the experts here at AGE to help me in my caregiving journey, because things change. And even though I am in the industry, there are things I certainly don't know. I don't know where the resources are for some things. And so it's always great to have that person with their arm around you saying, we're here to help you out. So that's always wonderful. And it leads me to one final thing. We've talked about this, you and I, offline, but day centers really are another tool for a caregiver. It's another tool in our arsenal belt that we can use to help make our journey successful, not only for ourselves, but also for our loved one.
Exactly. I think day centers have so many good things going on. We can slow down cognitive and physical decline. People are getting out of the house, battling loneliness, which has been such a huge buzzword in the last couple of years with COVID. And now that day centers are open and thriving again, I really encourage you to take advantage of that so you can get those benefits from day programs like ours. I think additionally, it helps people stay at home as long as possible. If transitioning to a long-term care community is another goal, I think that is a great benefit of the day centers, is this really prepares the older adult for that kind of structure in their day. And they can kind of slowly dip their toes in that pool of activities throughout the day, having somewhere to be, making new friends, but still going home at the end of the day until maybe it is time to look at a long-term care placement. And they feel a lot more comfortable about it because they've already done it and they've seen how fun it is, and they've seen the benefits themselves.
That's such a great point. We're all living so much longer. And because of that, we are living to the point where many of us will need to go to a long-term care community because it's not safe for us to remain in our homes. All of us want to stay in our home as long as we can, but the reality is we're going to reach a point where that's not practical or safe. And it's a big transition, emotionally, and not just the physical move of it all, but the emotional of it. And using adult day health as that transition to that is such a great idea, because you get to experience what it would be like to be at another community with other people for the majority of your day. And that's the way most of the long-term care communities are built. You have your room, but that's where you sleep at night. You spend your day inside the community doing all the great fun things during the day. And that's the goal. You don't want people to just stay in their bedroom staring at their TV all day. We don't want them to stay at home staring at their TV all day. That does us no good physically or mentally. And so being able to go somewhere where you can spend the day with all those great activities makes it easier to bridge when we do need to talk about assisted living, skilled nursing, memory care. And it's something we've already been doing. So the only difference is we'll just have a different room where our bed is located.
Exactly. I think it also helps the care partner emotionally prepare for that transition as well. It can be really hard to trust somebody else to take care of your loved one. And by kind of training your brain to trust other people and know, oh, this is what to look out for. I've already done this with a day center. It really helps you prepare too.
That is so true. As caregivers, a lot of times we feel like when we need to move our loved one into a long-term care community, A little bit of us thinks that we failed as a
Mhm.
caregiver because we have to move them somewhere, when the reality is, no, we did not. This is just another tool in our belt, and we are simply admitting we don't have the skills, time, resources, knowledge to take care of this person at the level they need to be cared for. We need an expert to do it for us so that our person continues to thrive. And to do that, we're going to move them to a community where they have all of those resources. So, you never are failing when you are reaching out for that type of help. And that leads me to our final thing that we always say to caregivers: there is never, ever any shame in asking for help. Every one of us need help at some point in our life. And as caregivers, very few of us are fully trained in how to provide care, especially for someone who has a cognitive issue or a physical issue. And so asking for the help is not a sign of failure. It is actually your sign of intelligence, of saying, I'm not sure how to do this. And so I'm going to ask someone who does know how to do it. And that's why organizations like Age of Central Texas exist. We're here to be your partner in this journey with you and your loved one to make sure it's successful and healthy. And Adult Day Health is just one of those great opportunities that you have as a caregiver to take care of yourself, which is very important, and also to provide wonderful life for your care partner. Lauren, thank you so much for joining us today for the podcast. We appreciate your expertise, and thank you for everything that you're doing at the Thrive Social and Wellness Centers. We thank you for joining us for this information as well. If you need more information about Adult Day Health, about Age of Central Texas, or any of the programs that are available here in the Central Texas area, you can go to our website. We are online 24/7 at ageofcentraltx.org. Lauren, thank you again. I'm Rob Faubion for Age of Central Texas. We hope that you have a wonderful day.